All right, there you go.
Let's stand for the invocation by Chaplain John Gerhardt.
Thank you, Chairman Malone. Would you bow your heads with me for the invocation? Lord our God, it is written that we should love our neighbors as we love ourselves. And we who serve this great healthcare system have been granted the great privilege and the even greater responsibility of caring for our neighbors in this community. Help us to do so, we pray, with capable hands, with humble hearts, and above all, with mercy and with compassion for those who come to us in distress. May we care for our patients and their families as we would desire to be cared for ourselves. Please guide and empower us all as we seek to do so. These things together we pray. Amen.
Let's join together in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call the meeting to order of the Sarasota County Public Hospital Board on February 17th, 2015. And I understand we have a change to the orders of the day, which we need to approve.
Madam Chair, I move to amend the orders of the day to add motions to approve the recommendations of the selection committees regarding the ranking of the architects and engineers and general contractors for the St. Armand Circle Urgent Care Center as item 17, capital B-E.
Second.
We have a motion and a second. All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much. We have amended the orders of the day. And now we need to approve the minutes of the meeting of January 20th, 2014. I'll do it next. Any comments or questions about that? All those in favor of that motion, please indicate by saying yes. Opposed? Motion carries. Thank you very much. Now, let me,
You need to actually approve the amended order.
oh,
You amended them.
we amended them. Now we're approving the amendment. I apologize. So we need an additional motion that's now going to approve the amended. All those in favor say yes?
Yes.
Opposed? Motion carried. Thank you. Now, any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. So again, if anybody has anything they want to address that we're handling today, you need to get a card into our secretary, Ms. DeSisto, who's over here, so that we may hear your comments before we discuss that item. So we'll move on now to, actually the introduction's going to be by you, but the Lung Nodule Clinic, Dr. Joseph Seaman, who's a pulmonologist, is going to speak to us today.
Yes, I'm happy to introduce Dr. Seaman. We're pleased to have him. Dr. Seaman did his medical school training at Wright State University. He then went on to do his. He then went on to study at the University of Cincinnati. Did his internal medicine and residency program at the University of Cincinnati. Then went on and did a pulmonary and critical care medicine fellowship at the University of Cincinnati. He then went on from there to become an interventional pulmonary fellow at Denver at the National Jewish Health Center in Denver, Colorado. His special interests, or one of his special interests, are the management of solitary pulmonary nodules. So he's going to present today what he's done in the development of the lung nodule clinic here at Sarasota Memorial. Thank you.
First off, thank you for having me, and it's a pleasure to come and address the board today. So with no further ado, I'll proceed with the presentation. I just want to briefly give you some background about cancer, lung nodules, talk about the goals of the clinic, lung cancer specifically, some of the local impact figures of why we're doing this, and in a very brief detail of the program overview. Lung nodules are a rather common finding. Upwards of 60% of individuals older than 60 years of age can have a lung nodule. CAT scan screening can identify lung nodules that cannot be found on chest x-rays or in individuals who are otherwise asymptomatic. Recently, it was proven that CAT scan screening improves survival in patients later found to have lung cancer. The goals of the program are to improve lung cancer survival, reduce the time and frustration related to obtaining a diagnosis in lung cancer, overall enhance the quality as well as the value of the care delivered to patients, standardize and create a uniformed approach to patients with lung nodules, provide a conduit by which we can manage our data set and look for areas of improvement moving forward, and also to create a financially stable program moving forward. Lung cancer is the third most common cancer diagnosed in the United States, and the mortality rate associated with lung cancer is greater than the 5 of the other top 6 cancers combined. It has a significant impact in our environment with our residents. At present, 79% of cancers that are diagnosed in late stages, portending a very poor 5-year survival rate. Over the past 36 years, the rate by which new cancers are identified and deaths related to cancer have not changed substantially. In 2011, a landmark article proved that CT screening identifies lung nodules as well as improves lung cancer-related mortality. At the outset, identifying high-risk patients, we found that 1% of patients will have lung cancer at time of screening, and within 3 years, they will have a 3.6% chance of having lung cancer. With CAT scan screening, we see that most patients are diagnosed at an early stage, seen here. 63% will be diagnosed with an early stage, whereas 30% will be diagnosed with a regional or distant spread of disease. Why that matters is because it improves survival. Here we see a graph detailing early stage 1A and 1B have a far superior 5-year survival than those who have distant or regional disease, seen here. In summary, lung cancer screening results in a shifting of the stage of diagnosis so that we're identifying patients at an early stage with an overall improved survival. In addition, 1 in 10 patients will be found to have a clinically significant finding other than cancer, which will allow us to intervene and perhaps improve their clinical outcomes in ways not otherwise expected. More specifically, our local impact, we see patients from the Tri-County area. In the Tri-County area, we have 780,000 residents, of which approximately 150,000 would meet screening criteria. That would mean that at present we have between 1,500 and 4,000 cancers in our community, as of yet non-diagnosed. By using the logic and the numbers, that means that approximately 1,000 to 2,400 could have early diagnosed lung cancer in an effort to improve their overall 5-year survival. So we have a significant opportunity here to improve the health and well-being of our residents. The program specifically is going to be a clinic without walls, not necessarily a defined space. What we want is a facility that's going to be able to be used not only by physicians here specifically at SMH, but also for patients to be referred in from the community, so that we're not restricted to one provider in one location. We're going to use a multi-professional and a multi-dimensional team of medical providers from multiple disciplines, as well as nursing staff, nurse practitioners, and other professional staff to provide and enhance the quality of the care delivered. We anticipate that late spring, this clinic should be operational. Be happy to entertain any questions.
Any questions for Dr. Seaman? Thank you so much for your
We have a
presentation.
question from the audience. So in a high-risk individual, which would be defined as somebody between ages 55 and 75 by Medicare guidelines, that has a significant smoking history, 30 packs or more, we would recommend a screening CAT scan between those age ranges, and then annually thereafter.
I think we had one other question, Mr. Henry.
Yes, sir.
Thank you.
You're welcome.
Do we currently have sufficient CAT equipment here?
We have the equipment available. We have the CAT scans in sight. We just need to build the program around it to provide the infrastructure to be able to meet the goals and needs.
Good. Thank you so much again.
Thank you, everyone. It was a pleasure.
And now we have the February Excel winner, Mr. George Verdoni, Room Attendant Hospitality Services Division.
Jorge, come on up here.
Jorge.
Right here, buddy. Okay. Today it's my pleasure to introduce everyone to Jorge Verdoni, who is our Excel recipient for the month of February 2015. Jorge is a room attendant in the Hospitality Services Division and has been an employee of SMH since May of 1994. Jorge is going on his 21st year here at Sarasota Memorial. Some of the words that are used to describe him: fantastic, shines like the sun, above and beyond is his middle name. These are all quotes from Jorge's nominations. Jorge is loved by all the staff on the unit as well as every patient and family member he interacts with. He really brings a relaxed element to those who are very ill and in a high anxiety environment. Jorge is the best ambassador for our department. He is always one step ahead. He is always sharp in dress and mannerism. I have worked alongside him for 21 years, and I can say he is one of the most engaged colleagues I've ever seen at SMH. There's not a single soul he wouldn't do anything he possibly could for. Jorge is not only an exceptional employee, but he's an exceptional human being. Congratulations, and thank you for all you do. Good, Joe.
Jorge, this is a plaque that you're going to be able to keep this time, okay? All right. This is the Excel Award for February 2015, an employee recognition program of Sarasota Memorial Healthcare System. The hospital board and the administration staff of Sarasota Memorial Healthcare System are grateful to all employees who constantly enhance the quality of a patient's stay by making an extra effort in their daily activities. The Excel program is designed to recognize employees who have distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in our community. The hospital board and administrative staff are pleased to present to Jorge Verdoni with the Excel Award for February 2015 in recognition of your demonstrated courtesy and caring attitude and contributions towards excellence at Sarasota Memorial Healthcare System, signed by David Veringer, Chief Executive Officer, and Margaret C. Malone, Chair, Sarasota County Public Health Hospital Board. Congratulations.
Oh, you know you want to make a comment. Come on.
I just want to say thank you for my family I have for 20 years, Sarasota Memorial. I'm very proud to be here. Thank you very much.
Thank you very much. And next, we have the leader of the first quarter this year, Robert Altiero, Manager of Integration and Projects, Clinical Business Systems.
Robert, come on up. We can make sure you're fully on camera.
Okay.
Okay. The recipient of Sarasota Memorial Hospital's Leadership Award for the first quarter is Robert Altiero. Robert's been an employee of SMA since June of 1993. He is the Manager of Integration and Project in Clinical and Business Systems. Robert is a great leader, and that is evident from his many nominations that came from all across the hospital. However, there's a common theme that is repeated over and over, and it is that Robert is a genuine and approachable. He is supportive, down to earth, and in touch on all levels. And so, Robert, here's a couple of comments your peers made. We've weeded out the most embarrassing ones, okay? Mm-hmm. All right. So Robert has become one of the best managers I've had at SMH, and I've worked here for 18 years. I feel free to professionally argue with him without fear of repercussion. He values our opinions and really goes to bat for his staff. Robert thinks outside the box and doesn't stick with status quo when it's obvious the current process isn't working. In fact, in the action plan, the number 3 flow sheet is called Robert's Real Cool Stuff. We said we'd get marketing on that, right? Okay. To ensure that his actions have a positive impact on the world of nursing, he rounds on units and visually see that his really cool stuff is working properly. Robert displays excellence in leadership by his ability to build excellence in his staff. He shows respect for all levels of employees and uses a fair-minded approach when communicating. It's truly a pleasure working with Robert. He offers insight as a leader, but always remembers the perspective of the bedside nurse. He is part of the CDIT team and engages the group to debate and offers the devil's advocate view so all angles are explored. He is supportive of nursing to minimize duplicate work and strives to keep the nurse a nurse. Robert has created the atmosphere of individual learning and development so that personal growth is required and rewarded. Everyone enjoys coming to work. He's a brilliant, and most say he's usually at least 50 steps ahead, but of course he remains very humble. Sorry, you have a second page here. Oh, okay, I'm right. One person said it best. Robert being nominated for the Leadership Award is a no-brainer. So congratulations, Robert.
Thank you.
Robert, we're going to leave you with a little something to remember today, and really more of a thank you. And if I stumble, please I'll apologize in advance. This is an eye chart for me here. The SMH, this is a quarterly leadership award, SMH CS Leadership Award, a leadership recognition program for Sarasota Memorial Healthcare System. The hospital board and administrative staff of Sarasota Memorial Healthcare System are grateful to all leaders who constantly enhance the quality of a patient's stay by making an extra effort in their daily activities. Inherent in that leadership is the ability to enhance employee satisfaction and act as a role model to inspire our staff to become the very best that they can be. As that role model, you have developed a department that is a benchmark of excellence for the entire organization. The leadership program is designated to recognize leaders who have distinguished themselves by superior performance and attention to others. Individuals recognized are models of excellence who strengthen the quality of patient care, staff satisfaction, and the image of Sarasota Memorial Healthcare System in our community. The hospital board and the administrative staff are pleased to present you, Robert, with the Sarasota Memorial Healthcare System Leadership Award for the first quarter of 2015 in recognition of your demonstrated leadership abilities and contribution towards excellence at Sarasota Memorial Healthcare System. Signed by David Veringer, CEO, and Margaret G. Malone, Chair, Sarasota County Public Health Hospital Board. I got through it. Hey, congratulations.
I'll just say I've always been very honored to work at this hospital. I feel privileged to have worked here as many years as I have, and privileged to work with many great people, both staff that have worked with me and the leaders that I've worked and learned from. So thank you very much.
Thank you. Next, the Excel Winner of the Year, Joe Garaccio, Supervisor, Hospitality Services, Environmental Services.
Come on, Joe. So, come a little closer. All right, there you go. I don't want you to miss the frame. All right. We recognized Joe earlier at a management council, so we gave him his gifts and everything at that. So, but I wanted to make sure we came in and recognized him to the whole board and to the public. As you know, each month as one of our employees is chosen as an Excel winner. The Excel Employee of the Year is selected by the Excel Committee, which is made up of past Excel recipients. The Excel winner for April 2014 was Joe Garaccio. Joe is a supervisor in hospitality services and has been an SMH employee since July of 1993. Always dependable, a can-do guy with a can-do attitude. These are just a few words from coworkers and staff that made up the original nomination for Joe. And that's why Joe's been chosen as this year's Employee of the Year. So congratulations, Joe, and thank you for everything you do.
It's an honor. I appreciate everybody that said kind words about me. Thank you.
Now we have the Leader of the Year, Connie Anderson, is the Director of Progressive Critical Care, Neuro Departments, and Nursing Administration.
Okay, so each quarter, an Excel Leadership Award is given, as we just saw a minute ago. And from those 4 leaders, senior management chooses an Excel Leader of the Year. This year's Excel Leader of the Year is Connie Anderson. Connie has been an employee since October 1997. She's the Director of Progressive Critical Care and Neuro Departments in Nursing Administration. It's no surprise that Connie's nominations were glowing. Many of the comments describe Connie as a leader who effectively motivates and motivates her staff. Connie takes a personal interest in her staff and is engaged and encouraging as she helps them achieve their personal goals. Connie, thank you, and for a great year. I appreciate everything.
Thank you very much.
Just want to thank everybody. It's a great place to work. I smile because Robert's here, and Robert was instrumental in hiring me. So years ago, it was 17, 18 years ago, we worked together on 80s Tower. So it's nice to see that too. Thank you very much.
Thank you. And now we have the Hero Award winner, Rob Tremblay, Autopsy Technician, the morgue.
Rob, come join me. All right, you in frame. All right.
Okay.
So, before I kind of start into this award, I wanted to just make a little comment. Rob is a Hero Award is a little bit different than most. We hear from a lot of people who are heroes because they stopped because somebody had a heart attack or was in a car accident and helped them. And I think it's just particularly rewarding for what he did here, and it's a little bit unusual. And so how about that for setting up a story?
That's good.
Okay.
Thanks.
So early last year, Rob received a call from a woman outside the morgue garage door asking if he could come down and talk with her. He asked her who she was and if she knew him, and she said, "No, but I want to talk with you." Rob and his work associate, William Rewis, went down to the receiving area to meet the caller. She introduced herself and told them she had saw the medical examiner receiving sign on our door and knew she was in the right place. She told them that she was there looking for end-of-life measures, but not suicidal. Rob asked her if she was depressed, and she said no, but she was looking for a way to check out. She had parked her car in the roadway, so he asked her to park in a parking lot west of the receiving area and told her that he would be back to assist her. During that time, she told William that she had recently lost her son and husband and had had financial trouble. Rob went back up to the morgue and called his supervisor, Ruben Rivera, who told him to call nursing administration. He promptly talked to the nursing supervisor, and she came to the department immediately. Reuben had also contacted Public Safety, and they were here in minutes. Together, they escorted the woman to the ECC, and she was immediately taken into care and eventually admitted to Bayside. By listening and taking her seriously, Rob helped this woman get the care she needed. So thanks, Rob, for taking this action and preventing another person from hurting themselves. Thank you very much.
Rob, just a little plaque of really not much from the standpoint of what you did for the woman, but I think we need to really recognize your efforts and hold you up as something that we all need to reach that level. Rob Tremblay is hereby inducted into Sarasota Memorial Healthcare System Team SMH Hall of Fame as a hero on this 4th day of February 2015 for meritorious customer service, including consistently exceeding expectations of our patients, families, visitors, and staff, being an example to peers and others, having a personal commitment to excellence, and going above and beyond for individuals in our community. Signed today by David Varinger, President and CEO, and Margaret G. Malone, Chair, Sarasota County Public Hospital Board. Congratulations.
Thank you. Thanks to Reuben and Charlene Harris for nominating me for this. It's an emotional thing. I deal with death every day, and we went above and beyond, so thank you.
Thank you. So we'll move on to the report of the medical staff. Dr. James Fiorica, Chief of Staff.
Yes, I have 3 items for the board. The first is following the recommendations approved by the Medical Executive Committee on January 26. The first is to accept the resolution of the Medical Executive Committee regarding trauma.
I move acceptance of the recommendation from the Medical Staff Special Committee on Trauma, supporting the development of a Level 2 Trauma Center as approved by the Medical Executive Committee.
We have a motion and a second. Any comments or questions? All those in favor of the resolution, accepting the resolution, please say yes.
Yes.
Opposed? Motion carries. Thank you.
Next is privileging criteria for implantable cardiac loop recorders. That was approved by the Medical Executive Committee on January 26.
I move approval of the privileging criteria for implantable cardiac loop recorders as recommended by the Medical Executive Committee.
We have a motion and a second. Are there any questions or comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And third, privileging criteria for CardioMEMS implantation as reviewed and approved by the Medical Executive Committee on January 26.
I move approval of the privileging criteria for CardioMEMS implementation as recommended by the Medical Executive Committee.
We have a motion and a second. Are there any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you very much.
That concludes my report.
Thank you, Dr. Fiorica. We'll move on to the auxiliary report. Ms. Dottie Ziegler, Auxiliary President. What is this? Oh.
Thank you, Madam Chair. Sarasota Memorial Public Hospital Board has strategically planned to meet the health care needs of all of Sarasota County. The Northport Emergency Center meets the needs of the residents of South County. Northport residents are interested in serving in this facility to support the care provided. This month, we added a new group of volunteers to the established volunteer corps. Stacy set up the necessary interviews and training to fill the opportunities for service. Stacy, Dan Trigg, who's our treasurer, and myself went to Northport on February 3rd for an all-day orientation for the new volunteers. The information given was what we give to our new volunteers here. Carrie Kundra, the director of the facility, arranged for the necessary medical tests to be done in the Northport facility rather than the usually done here at Employee Health. It usually would involve the people from Northport going back and forth several times for all of this to be completed. So that's why we tried to do some of it there so they didn't have to make that trip. So Stacy took a couple of pictures so that you can see of the Northport area. This is a picture of the new volunteers. We call this our 3 Sues and a Joan picture. Sue Trousel, Joan Donahue, and Sue Turner and Susan Burke. We had 3 Sues that were new volunteers. Carrie Kundra is the ambulatory director. She's a director of that area. And Phil, the tall gentleman on the end, is the chairperson of the Northport ECC Volunteers. Direction, good. The training at Northport was adapted to their facility. The volunteers don't have to use too many stretchers because most of their people come in are wheelchair people. So we gave them some wheelchair training, and there is a tact and a way to properly pushing people into wheelchairs. So this training that you see here was with Sue Trousel, Sue Burke, and Phil was the person that was training them. I might add that Sue Burke is Phil's daughter. Safety training. All of us need safety training, and we're very appreciative to Rich Miller, who you see there, coming down to give training to our training on working with difficult people and people in crisis. Even though the facility there is much smaller than our facility here, people that come in there still have the same needs and need the same courtesies and the same treatment that we get in the bigger ERs. One last picture. This is Sue Trousel and her niece, Shelley. Shelley actually works at the Northport facility. So you can see the best referrals that we have are from family members or other volunteers for new volunteers. This completes my report.
Thank you very much. We'll move on now to the Sarasota Memorial Healthcare Foundation. Alex Quarles, President.
Thank you, Madam Chair. For those of you that attended our gala, thank you very much. I hope you enjoyed it and had a good time. I don't have a final number for you yet because we are doing some negotiating with the Ritz-Carlton at this point, but suffice it to say, we probably netted close to $200,000. The Employee Partners in Caring campaign, I think, kicks off early next month, and thanks to the employees, I have to tell you, the number is significant, and almost 100% of the departments participate, and a lot of the grants that they give to us or the donations go to mostly nursing and technology support for the hospital, so it's where a lot of the smaller things come from. The physician sculpture, if you haven't seen it, we had a dedication on February 5th. Mickey Fine and her family donated a sculpture that is to recognize physician contributors, and those names will be going up soon. Hopefully those that have given to us already will have their name up by Doctor's Day, and we look forward to seeing more involvement there. On the 18th, we have the Starlight Foundation Pediatrics Ribbon Cutting. They are affiliated with the Selby Foundation. Sorry, this cuts in and out. The board in itself is reviewing investment strategies for long-term goals, staffing, and the different types of things we're going to do a better job and to certainly raise more money for the hospital. So we're in a major strategic planning process and growth now. And I'd like to finally say thank you to Chief Mickey Watson and the Safety Department. Their department came together and brought us a very nice gift from their department to be used where the need is greatest. So thank you, Chief, for taking care of us and your support. That concludes my report. Thank you.
Thank you very much. And the Secretary's report, Mr. Thomas Towler, Secretary.
Thank you, Madam Chair. I have the board March on Tuesday, the 3rd, At 8 o'clock, board breakfast, 9 o'clock, the quality committee, 10 o'clock, 11 o'clock, HR committee, and 12 o'clock, governance effectiveness. And on Monday, the 16th, again at 1 o'clock, the public board meeting. That's my report, Madam Chair.
Thank you very much, Mr. Dowd. And the treasurer's report, Mr. Joe DiVirgilio.
Madam Chair, I have one item today, and that is approval of the bad debt and charity care. And I move approval of the bad debt and charity care for the month ended January 31st, 2015, in the amount of $11,939,000.
We have a motion and a second. Are there any questions or comments? All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. And now the first operations report, Mr. Bill Wojin, Chief Financial Officer.
Thank you, Madam Chair. I have the financial highlights for January 2015. Our operating revenue for the system for January, $55,666,000, compared to a budget of $51,330,000. We are now 4 months into our fiscal year, and for fiscal year to date, operating revenue for the system stands at $201,874,000, compared to a budget of $188,585,000. Total expenses for the system for the month of January, $51,031,000, compared to a budget of $50,429,000. 4 months into our fiscal year, the totals are $197,445,000, compared to a budget of $191,379,000. Systems operating income in the rating agency format for the month of January, $7,421,000, which represents an operating margin of 12.5%. Fiscal year to date, $15,312,000, for an operating margin of 7.1%. January year-to-date hospital statistics, average daily occupancy, 424, compared to a budget of 376. Admissions, 9,027, compared to a budget of 8,830. Our average length of stay so far this year, 4.91, compared to prior year of 4.49. Hospital surgery cases for fiscal year to date, 6,574, compared to a budget of 6,246. So far, we've had 1,097 births in the fiscal year, compared to a budget of 998. The hospital's outpatient registrations for the 4 months, 138,815, compared to a budget of 138,299. Emergency care center registrations, 38,507, compared to a budget of 34,289. Our case mix index for the 4 months, all patients 1.7, and for Medicare patients 1.93. Madam Chair, that concludes my report unless there's any questions.
Hearing none. Thank you very much. And now our second operations report from Ms. Jan Mock, Chief Nursing Officer.
Good afternoon. First, I'd like to start and tell you how proud I am to say that because of our great results with HCAHPS, which you all know very intimately, that we've been on this journey to improve our patient experience results. We are recognized throughout for those great results. We have people coming to visit us to see what we do. That makes us very proud to be able to share. We have Tampa General, who we're sending our Judy Weiser, our program manager, up there to work with them In exchange, they sent their trauma program director down here to work with our ER and help us. So it's a good trade there. And also, we have some friends from Michigan. We have several CNOs from Ascension. I think you know where that comes from, who will be coming and we'll be working with them on our patient experience. So I think that's a real honor for us to share what we've been successful at with others, and we're very proud to do that. I'd like to recognize the First Physician Group. They will be featured in the next MGMA Performance and Practice of Successful Medical Groups, which is reported annually for their superior performance in accounts receivable and collections. Congratulations to Eileen Gilbert and the team for that great work and recognition. We have, as you approved, thank you, 3 new robotic rooms that have been redesigned in the operating room, which are now finished and ACA approved, and they will be opening on Monday. So in front of you is a picture of one of those new rooms, and we've talked about size of ORs and the necessity to have equipment off the floor and have them large enough for the type of work we do. So in this picture, this is just one of the rooms. There will be 3 like this. You can see the size of the room, which is very nice, and all the equipment's up off the ground with integrated equipment. So our physicians, I know Dr. Fiorica and others, are really anxious to get into these rooms. As you remember, this was created so that we could have efficiencies with them all being located in the same place with equipment and supplies and the team. Safety for both patients and staff, and visibility for the operator to be able to see the field. So they had input into the design, and we thank Tom Perigo and Jim Bookish for their support here, and we look forward to moving into that room. On Monday, we have the honor of having the Joint Commission for Advanced Heart Failure Certification here, and we're very prepared to share with them the great work we do and the outcomes and successes we have. So I'll report that to you later. And in closing, I want to share a video with you about a new program that we have for our cancer program. He's going to get it for me. While he's doing that, I just want to tell you we're very proud of this, and we have a great cancer program, which in our strategic plan is really to enhance more. And because of this great program, the people who put this together will be speaking at the National STARS Conference for this best practice that we have started here in our community. So I'll let you listen to it. Some of you might have seen it, but it's something worth showing again.
Other news tonight, a state-of-the-art hospital program in Tampa Bay is giving cancer patients a new lease on life. Chemotherapy and radiation treatments can rob a patient of their abilities and strength, but a unique Sarasota program helps them restore what cancer took away. News Channel 8's John Rogers joining us now live from Sarasota. This is exciting stuff going on there, it sounds like, John.
It certainly is, Gail. It's called the STAR program. It's a special rehab program offered here through Sarasota Memorial Hospital. SMH is one of the first hospitals in the state and one of the few hospitals in the country to offer this.
You don't realize how difficult it is sometimes.
I didn't touch it. I'm sure glad you're here. It worked fine when we practiced before. I think it must. Let's try this again.
When it comes to life at home, we're plugged in. That's why Tampa Electric offers customized surge protection for your home electronics and major appliances. Visit tampaelectric.com/zapcap or call 1-877-SURGE-22.
Other news tonight, a state of exciting stuff going on there, it sounds like, John.
It certainly is, Gail. It's called the STAR program. It's a special rehab program offered here through Sarasota Memorial Hospital. SMH is one of the first hospitals in the state and one of the few hospitals in the country to offer this.
You don't realize how difficult it is sometimes to be living with cancer until you've been there.
In 2009, Howard Cowdrick was diagnosed with prostate cancer, and his 27 radiation therapy treatments were only the beginning of his personal hell.
You don't have any control over your life anymore. You're working very hard at trying to stay alive.
Okay.
Cowdrick became physically and emotionally drained and nearly incapable of living a normal life.
Okay, just a good warm-up.
But that changed in August when he joined the STAR program.
Our goal really is to get them from, surviving to thriving.
STAR stands for Survivorship Training and Rehabilitation.
And let's go ahead and work on your balance.
Each cancer patient is given specialized therapy tailored to their needs. And the offerings run the gamut. It's not just physical therapy. There are specialists in speech, nutrition, even psychology.
It really helps people get back to a new way of living and hopefully back to what they were doing before.
I feel like I'm a little bit more in control of my life.
The STAR program has restored Cowdrick's strength and stamina. He's even started riding a bike for the first time in a year. But ultimately, it gave him hope.
And it makes you realize that you can beat this. You can actually get better.
I'm told this is such a new program that many doctors aren't even familiar with it yet, but the word is spreading. And if you'd like to know more information, I put a link up for you on our website, WFLA.com. Just click on links mentioned. In Sarasota tonight, John Rogers, News Channel 8.
So I think you can see why they want us to come and speak. I would like to thank and recognize Laura Magnuson, our manager of rehab, Kelly Batista, senior manager of outpatient, and Sherry Ireland, the physical therapist you saw in the video, for helping put this program together. So again, best practice started right here at Sarasota Memorial Healthcare System. And that ends my report, Madam Chair.
Thank you very much. So we'll move on to board reports, and we do have one today, and it's the approval of board resolution on Level 2 Trauma Center. And let me just say again on behalf of the board that we are so proud to represent all of Sarasota County and to be able to lead in a decision that's going to bring, we think, even more fabulous service and commitment and care for those around us. We want to thank Dr. Fiorica, Dr. Taylor, and our CEO, and the others who have worked so hard to make this happen, because it was going to have to be a decision made by the medical staff and the nursing staff and the folks that really were going to have to do it, because it's a very weighty and heavy obligation. But we are passionately committed to doing this. It's something that we feel is absolutely right for this county. And it not only is a passion and a moral need and something we should do, but it has all kinds of statutory and regulatory things that go along with it. So in doing this resolution, we've asked our chief legal officer to read the resolution, and then our secretary is going to make the motion. But we are all very, very excited about what we're doing here. And again, we thank everybody who's worked on it, and we're just so pleased that we're going to be able to do this for our county.
I'm very proud today to publish this resolution of the Sarasota County Public Hospital Board, which I believe reflects the board's, articulates the board's hopes and beliefs and commitments with regard to trauma. Whereas the Sarasota County Public Hospital District, and its governing authority, the Sarasota County Public Hospital Board, the board, were created to meet and have a long-standing history of meeting the community's evolving health needs, improving access to care, and providing the most advanced treatments and technology, including through the operation of the Sarasota Memorial Hospital, the hospital. And whereas the Sarasota Memorial Hospital is Sarasota County's only nonprofit hospital and is the sole provider of essential safety net services, and whereas the hospital has been recognized repeatedly as one of the nation's best public hospitals with superior patient outcomes and a complete continuum of care, including being the only hospital in the region with Magnet Nursing Services recognition, being regularly included among U.S. News Best Hospitals in the region, and having among the lowest readmission rates in the nation. And whereas the board has been properly advised on the issues related to the operation of a Level 2 trauma center, including the regulatory requirements, the costs, the impact on operations, the personnel required, and the impact on the medical staff, and has determined that providing trauma services through a certified Level 2 trauma program is in keeping with the board's commitment to delivering the highest level of care to the widest number of community members. And whereas the hospital's broad scope of services, depth of experience in providing emergency and acute care, including specialty care, location, accessibility, and excellent quality, all place the organization in an optimal position to serve as Trauma Service Area 13's new Level 2 trauma center. And whereas the hospital's organized and independent medical staff, composed of outstanding physicians, well-trained and experienced in every major specialty, including those specialties critical to the success of a quality trauma program, has considered and endorsed by its own resolution the establishment of a Level 2 trauma center at Sarasota Memorial Hospital. Now therefore be it resolved that the Sarasota County Public Hospital Board and Sarasota Memorial Healthcare System Administration are wholly committed to ensuring the successful operation of a trauma center by allocating adequate resources and personnel to accept and care for trauma patients. And be it further resolved that the Sarasota County Public Hospital Board is committed to ensuring the availability of financial, human, and physical resources to treat all trauma patients at the level of the hospital's approval, regardless of color, creed, sex, nationality, place of residence, or financial means. And be it further resolved that the Sarasota County Public Hospital Board is committed to participating in the state regional trauma system and the local or regional trauma system if one exists. Passed and adopted in the regularly scheduled public meeting of the Sarasota County Public Hospital Board in Sarasota County, Florida, this 17th day of February 2015.
Madam Chair, I move adoption of the resolution regarding the establishment and operation of a Level 2 trauma center at Sarasota Memorial Hospital as read.
Everybody seconded. That's marvelous. Any comments or questions? We have a motion and a second. Lots of seconds. All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. That deserves a thing. Thank you very much. So, we'll move on now to committee reports. Investment Committee, it's Alex Miller, Chairman.
Thank you, Madam Chair. The Investment Committee met on February 3rd. We reviewed 3 areas of investments. First, the fixed income outlook. Colin Robertson, who flew in from Chicago from Northern Trust, discussed the fixed income market. He advised us we are in an environment of extremely low interest rates with global growth slowing, declining inflation, and declining growth expectations. The trend is toward lower GDP growth, and he believes high unemployment will continue. Economic growth will be slow at best. Second, we reviewed board designated performance or designated fund performance. Mr. Robertson also discussed investment returns for the enhanced cash and intermediate fund portfolios. He noted that quarterly performance is better than the indexes. Over the past 12 months, performance for the enhanced cash portfolio is at 1.09% versus the benchmark return of 12 basis points, and the intermediate fund portfolio returned 3.81% versus the benchmark return of 2.84%. Finally, we reviewed the retirement plan performance. Tim Sant of Summit Strategies reviewed the asset allocation versus target allocation, total fund attribution for performance, total value added, and manager value added. The fund had positive returns for the quarter of 63 basis points. Tim noted a mixed bag of performance, but overall the total value added by managers was 52 basis points. Mr. Stan is not making any recommendations for changes in the portfolio at this time. And that concludes my report.
Thank you very much. And then on to the Mission and Planning Committee, Mr. Greg Carter, Chairman.
Thank you, Madam Chair.
Mission Planning met also on Tuesday, February 3rd, and we started out, David Verinder introduced our new Chief Operating Officer, Lori Lang. And next, David discussed our strategic plan that was presented back in June, and that has to do with the 4 items on the agenda for that meeting that day: the Kennedy White Orthopedic Center, the St. Armand's Urgent Care Center, the OR expansion, and the Level 2 Trauma Center. And in his introduction, he stressed that these items all met vertical integration, effective use of capital, alternative care, productivity, and growth. And the first item was the Kennedy White Orthopedic Center. And, oh, by the way, these all met, Bill Wolchin mentioned that these all met the funding for strategic initiatives, and we do have the financial ability to invest in these projects. Frank Morgan introduced the discussion for expansion of MRI services, and this is a great opportunity to grow our market share in the area of orthopedics and increase our MRI volume. We will be investing in the system's first 3T MRI, and the estimated total cost is $2,355,000. The benefits were discussed, and the projected date of completion is October of 2015. Then Kelly Batista discussed the financials on this project and provided a financial forecast. She discussed growth of our outpatient radiology network and cross-reference opportunities to strengthen our outpatient market share. This will also strengthen our relationship with the Kennedy White physicians. And at this time, I move approval of the purchase of a 3T MRI machine in the amount of $1.5 million and build out of and furniture, fixtures, and equipment for the MRI suite to accommodate the MRI machine in the amount of $855,000 as recommended by the Mission Planning Committee.
Second.
We have a motion and a second. Are there any questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion noted. Motion carries. Thank you.
Our next item was the St. Armand's Urgent Care Center, and Frank Morgan presented the assessment team members and discussed the driving factors for this project. He provided UCC growth numbers, stating that there is a need for this area to be served. We are expecting 80,000 visits this year in our current facilities, and the ECCs will hit in excess of 100,000 this year as well. Financials for this department were reviewed, indicating very healthy financials. Jan Storch then discussed the proposed plan for the new UCC building. The building will be demolished, the existing building will be demolished, and we will design a new building at this time. She discussed the proposed building and property design. It will be 3 floors, including parking. Projected opening date is December 2015. The next steps include city approval, increasing the footprint of the building, additional square footage, shell space on the 3rd floor, and with final approval from the city. We hope to have a shared parking agreement, and a financial forecast was provided. David Verinder advised that we do not have all city approvals at this time, and Tom Perigo discussed our work with the city that is ongoing. The timeline is 5 months for the construction, and we will need approvals from the city, and this is pending also at this time. So I move approval of the planning, design, demolition, and construction of an 8,700 square foot facility to include an urgent care center, along with the purchase of such necessary furniture, fixtures, and equipment at the St. Armand's Circle site at a cost of not greater than $5 million as recommended by the Mission and Planning Committee.
We have a motion and a second. Are there any questions or comments? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
The next item was the Level 2 Trauma Center. And Gene Lucas presented the current status of the team's efforts for the SMH to become a Level 2 trauma center. She reported on the pros and cons of trauma designation for Sarasota Memorial. She discussed the medical staff trauma task force, which was chaired by both Drs. Fiorica and Dr. Taylor, and was presented and discussed their methodology and meetings conducted. Medical staff support was discussed, which includes trauma surgeons, orthopedic surgery, and neurosurgery in particular. Hospital partnerships were discussed in coalition with Tampa General Hospital with transfers. Jean discussed capital needs for this project, and a capital summary was provided at a total cost of $3.6 million. Jean continued discussion with operational needs for the trauma department, which includes staffing, OR and ECC nursing trauma teams, and physician fees. Overall financial impact for the next 5 years was presented. Department of Health application dates and next steps were discussed. Let's see, I move the approval of capital improvements along with such necessary furniture, fixtures, and equipment to prepare for operating a Level 2 trauma center in the amount not to exceed $3.6 million as recommended by the Mission and Planning Committee.
We have a motion and a second. Are there any comments or questions? All those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And the last item is the OR expansion. And Karen Benedict, Director of Perioperative Services, presented the expansion of the OR by 2 rooms. She reported on where we are today and the future needs. The OR was built back in 1993, and she reported on changes in OR's room size and recommendations, electrical needs, integration needs, lights, booms, carts, ceiling-mounted booms, increase in need for square footage, noting minimum requirements of 750 square feet. She advised a smaller room makes turnover longer and the surgical team must have adequate reach. Current OR status is 32 rooms, 6 at the Cape, 4 new ones, and 28 on the main OR. Karen provided the current state of the OR room, and 56% are at only 480 square feet. A fully integrated OR is 650 to 750 square feet. She reviewed the block time schedule and provided the waiting list for block time. The proposed site for the new operating rooms on the 2nd floor was shown, and the space opens to the sterile core, and that is optional. Family waiting will go onto the 1st floor in the area for which it was designed. The benefits of a fully integrated operating room were discussed. Due diligence is being done through surgical governance, nursing staff. Volume was discussed, and this will add 66 more hours each week to the schedule. At this time, I move approval of a construction of 2 new fully integrated operating rooms and the purchase of such necessary furniture, fixtures, and equipment in the amount not to exceed $7,545,000 as recommended by the Mission and Planning Committee.
We have a motion and a second. Are there any comments or questions? All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And lastly, this was not on at the committee meeting, but per the amendment in the orders of the day, I move to recommend the architects and engineers and general contractors for the St. Armand Circle Urgent Care Center as follows. For architects and engineers, local Lawson Group architects were first, Carlson Studios were second, C. Allen Anderson architect was third. And for the general contractor, Willis Smith was first, DeAngelis Diamond Healthcare Group was second, and Skanska was third. And these are as recommended by the selection committee established for the purpose of evaluating and ranking the applicants.
We have a motion and a second. Are there any comments or questions? All those in favor, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you.
And that concludes my report.
Thank you. So we'll move to the Quality Committee. Robert Strasser, Chairman.
Thank you, Madam Chair. I would like to propose a motion. I move approval of the plan for the provision of quality patient care services as recommended by the Quality Committee.
We have a motion and a second. Any comments or questions? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion carries. Thank you. And just before our CEO gives his president's report, I think I neglected to mention Jean Lucas when I was talking about all those that work toward the trauma center, and she has been very instrumental and led the charge, and we certainly appreciate her and her team very, very much. So I apologize for having missed that. Excuse me. So, David.
Thank you, Madam Chair. So I'm giving February President's Report, and as always, we're going to start with our year-to-date leader report card. So looking at our service pillar under our HCAHPS number, we have a goal of hitting 9 out of the 11 indicators at 50th percentile or better. I'm happy to report that we're actually hitting 10 year-to-date. In our outpatient patient satisfaction, which is our likelihood of recommending, we have a goal of 83rd percentile. We're hitting 84th percentile, so once again exceeding. In the people pillar, we have two indicators. The first is merits on time. We have a goal of 95%. We are still a little bit short of that at 92%, but making up a little bit of ground. In the turnover area, we have a goal of no more than 16% turnover, and I did check the math twice on this, or 4 or 5 times, and we're only at 5%. So really thrilled with that number, and especially with our high census, that is hugely helpful. I'm sure Jan would appreciate. Our quality pillar, we have organization percent of patient safety readiness, a goal of 95% or better, and I'm happy to report we're at the 99th percentile, or 99%. And in infection prevention, which is a combined overall standardization infection rate, we have a goal of being less than 0.95, and we are maintaining or doing better at 0.87. Financial pillar, we have an organizational finance goal, which Bill has already reported on, of 4.4% operating margin, and we are currently at 5.5%, so exceeding that. In the growth pillar, we have strategic growth organization goals of inpatient admissions. The goal is at 26,308. Our current run rate puts us at 26,499, so not a whole lot above our goal, but just slightly. And our outpatient registrations goal is 657,755, and we are currently exceeding that at 669,969. Now going into the service pillar a little bit more, looking at our HCAHPS scores, and you see the 11 indicators there. I'm happy to report that fiscal 15 year to date, we are now running at 10 out of 11. So in January we hit 9 out of 11. But year-to-date, 10 out of 11, and you can even see the one that we missed on, responsive to hospital staff, we missed by 1 point. So thank you all, thanks to all of our staff who concentrated on this each and every day. We look at our likelihood of recommending. As I reported, we are at the 84th percentile. Goal is 83rd percentile. And you can see the departments that are above the 83rd, the ones that are in that above the 50th, but hitting right around it, and then the ones that are below. Looking at our people, Alex Quarles had already mentioned this in her report, but I just thought it would be good to show it again. We had the Sarasota Memorial Healthcare Foundation, along with a generous donation from Mickey Fine, who partnered to bring us a sculpture for the new hospital campus in the Courtyard Tower Garden, which I think is just an incredible statue, Alex. The sculpture is in honor of Mickey's late husband, Martin Fine, who served as a volunteer in an emergency room at SMH for many, many years. The sculpture is dedicated to the countless physicians who provide life-saving work every day. So thank you for getting that here. Addition. Continuing in the people area, we had, and you see a picture of ABC reporter Alex Redmond, who was talking to SMH infectious disease specialist, Dr. Vega, about the latest news on 4 measles cases identified in Florida and ways residents can protect themselves. Her advice, first and foremost, get vaccinated. The vaccine is administered in 2 doses. The first when the child is 12 to 15 months old, and the second at 4 to 6 years. Adults vaccinated as a child should check with their doctor to determine if a follow-up booster is recommended. So we encourage that. We had our corporate volunteers were participating in several projects. So several staff members recently shared their expertise to help budding scientists and engineers develop their skills by serving as judges for the annual Sarasota Regional Science, Technology, and Engineering Fair, as well as the Gulf Coast Community Foundation's recent STEM Smart High School Summit. The summit judges assess teams in the STEM-related, which is science, technology, engineering, math, areas ranging from robotics designs to programming to scenario-based CPR tests. Thank you for our volunteers who continue to do us proud each and every day. Moving on into quality, and I'll just coincidentally show you the picture here. You have Jorge, who was Excel winner earlier today, sit in the picture with this cleaning device. So we have a new robot, the Trudy, which we call it Trudy, short for Total Room Ultraviolet Disinfector, is a portable disinfection system in use at SMH since this past January. It scans a room to automatically calculate the dose of UV light necessary, then emits a flash, killing nearly 100% of all pathogens and superbugs, including C. diff and MRSA, that pose serious risk of infection. Rooms will still be cleaned by hand, but high-risk areas will get the extra blast of sanitizing UV light. It's no-touch automated system, disinfects an entire room from a single position, including cracks, crevices, and shadowed spaces. We also have our 3rd annual Cardiac Summit coming up this weekend, this Saturday, and so we would just like to invite the board and the public and anyone else interested in attending that. We have a great list of speakers, and if you can't see some of them down here, we have Dr. Rick Yura, Dr. Hakeem Morrissey, Dr. Hardy Schwartz, Dr. Nair, and a few others, and we just would, I know that they appreciate having an audience, and I think year in and year out, this summit does a great job. And then finally, I'd like to ask Lori to come up and join me. We have, as the board has already met, but I'd like to introduce her to the public. We have a new Chief Operating Officer with us, and it's my new friend, Lori Lang, who is on her 2nd day at work. So she is still trying to find her way around the building, but she's going to do wonderful things. And Lori, I invite you to say hi.
Good afternoon. I'm delighted to be joining this fine organization, and what I've been so struck by from my first day of the interview through yesterday in orientation is the pride of everyone that I meet in this organization. The employees, members of the board, members of the community, when I'm out grocery shopping, it is evident that this organization is known for excellence. So I'm thrilled to be joining this management team and to be becoming a member of this community. Thank you.
Well, thank you and welcome. We're very glad to have you here.
Thank you, Lori, and look, we all look forward to great things, so thank you for being here. And Madam Chair, that is the end of my report.
Thank you so much. We have nothing on the consent agenda. Do we have any public comments? No public comments. Any additional legal matters? No. None of those. Having no other business, this meeting is adjourned.